helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Hattie Cheek. We have folks from Cabell Huntington Hospital with us today. We're all guilty of it from time to time, getting an injury and perhaps not getting it checked out. But you guys say it is definitely important that you get checked out. And summer, it's a big time for you.
That's right. We have a lot of injuries in summertime. People on the ATV accidents, people outside doing things, saw injuries, things like that. So people have a lot of hand injuries we see during the summertime.
And why is it so important that they actually get checked out? They don't just let it go?
Well, I'm a certified hand therapist, so I think the hand is a very important body part. It's how we interact with our life. When we get up in the morning and we comb our hair, brush our teeth, the work we do throughout the day. Throughout the day we use our hand for everything. So I think the hand is a very important body part that we need to check out, make sure we treat it correctly, and that way we can resume our normal activities when we have an injury.
Yeah, and why do we need it to be able to recover through everything? Because you really do need to walk someone through that kind of process.
I think the hand itself is a pretty intricate part of the body. If you look at the anatomy and the physiology of the hand, it's pretty unique when you talk about the bony structures, the muscles, all of those things. And it's actually sort of almost a subspecialty in the rehab world that requires someone with specific knowledge in that area to understand how the hand functions when an injury occurs, what the specific rehab process is, what's needed specifically for someone that's suffering from a hand injury. Because as Jason said, it can be very debilitating if you don't have that first point of contact with your environment, which is the hand functioning properly. It's very limiting to what you can do functionally.
And I've got to ask, what makes a therapist or gets a therapist into hand therapy?
Sure, great question. You know, I think what we see in our world in the rehabilitation field is sort of a movement towards specialization.
Okay.
We used to all be therapists that would kind of be generalist in nature and treat everything, but like we mentioned before, what we're seeing is kind of almost an evolution into a specialization, and the hand is one area that we really focus on because, like we said, the anatomy, the physiology, the functioning of the hand is so intricate. Could go into a lot of detail about the bony structures, the muscles, all of those things require special training, special education, special work. So, you know, in our world, Jason is a certified hand therapist that has dedicated hours in training and specialized testing to be a specialist in the world of hand rehabilitation specifically. Okay,
and then we talked about there's ATV accidents, there's saw accidents. What kind of therapy do you guys normally see?
We see, my focus mostly the upper extremity, any from the hand to the shoulder. We see acute injuries like the fractures, sprains, dislocations. We may see tendon nerve injuries, nerve compression injuries like carpal tunnel syndrome or cubital tunnel syndrome, tendinitis like trigger finger, tennis elbow.
Is that, I bet, like everyone sitting down at the computers all day, is that just terrible?
It definitely plays a role. Body positioning is very important.
Yeah, you can get
all the phone
texting from ATV accident and from sitting at your computer and doing work. There's really no safe place.
That's right, they're out there, that's right.
All right, so you guys have brought a few things for us today. What is it that we're looking at? What do you use these for?
Well, when someone comes in to see us for therapy, the first thing we do is an evaluation. We look at their range of motion, their strengths, their coordination. So we use these tools.
Okay.
To check out the grip strength.
Oh goodness, what is that?
It's a test your grip strength, the dynamometer.
Okay, so what do I do?
So you're going to hold this to your side.
I'll hold it.
And right out there, open your hand up.
All right.
Right, there you go.
And what is this doing?
It tests your grip strength.
Okay, all right. So I can squeeze as hard as I can?
Hard as you can. Squeeze, 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 squeeze. Good, relax.
How am I doing?
Good.
Am I strong?
You're right at 70 pounds. That's good.
That's 7. Oh, okay.
That's very good. Very good.
That's very good. Yeah, that's right. That's right. 70
good
pounds.
Grip strength. Absolutely. You can do what you need to do. You can function very well.
Awesome. And then these for if anyone gets hurt.
Yeah, a big part of our practice is making splints. And we make static splints like these. Someone has a fracture or tendinitis, you might want to rest it. We also make dynamic splints like this.
Yeah, I was going to say that is awfully dynamic there.
Yeah.
What's that about?
Well, someone has an injury and they can't, maybe a radial nerve injury, and they can't open their fingers. They use this splint to kind of wrap around the fingertips here.
Oh, okay.
And pull that down.
You just plate the fingertips in there?
Yep.
Very interesting.
Pull that down. Now then help open the fingers up if you have an injury like that. And also allow a safe range of motion if you have a tendon injury.
Oh, all right. Well, lots of good information. If you guys have any questions, as we said, you know, a lot of people need treatment. They need to seek it. So you can just head to our website, WSAZ.com. Click on that Moms Every Day tab. You'll be able to rewatch this interview and be able to get in touch with these guys. And also, I want to remind you, we have a back to school segment coming up on August 5th from 11 a.m. till noon. We'll talk more about that as it gets here. More Moms Every Day after the break.